I'm happy to.
Yeah.
For me, it's being able to perform and stay as active as I age into my 40s, 50s, 60s, and 70s as I am in my 20s and 30s. And how do I keep my peak? How do I extend my peak till my 80s is really my goal.
Yeah. So the question was, how can I age in a healthy way so my performance, whether it's the brain performance, physical performance, any performance, can be maintained at a useful level. And I think that's what we're looking for. Aging, I don't know how many people want to live to 1,000 years. I mean, who can live with somebody for 1,000 years anyway? But you want to live well. So that's why you want to be able to wake up in the morning, have energy. You want to feel that nothing is stiff. Hopefully the body's not talking to you. I mean, it's a good sign, right? And you want to have energy that's even throughout the day. You don't want any symptoms. You don't want those symptoms. And but it's been very elusive. What does aging mean? You could look at somebody and say, "Oh, you look young. How old are you?" That's fine. You could do a blood test and get cholesterol and blood pressure and say, "Oh, you may not look so good." But that's two different things. And what we're going to be talking about is epigenetic aging. That is the latest and the most accurate way to define your true biological clock, not your chronological age. We can still use telomeres, but we have more precise ways of measuring, and telomere is part of it. So we'll get started. And this one, I'm going to go actually to this. What we want is not to live forever. We want to live well. So when you look at the first typical lifespan, you've got the green and a little yellow, but there's a lot of red there. You're living, but you're not living well. And that's where you wake up and your body's complaining. I don't know about you, but I usually try to ask people, how old are you? And then I say, well, how old do you feel? That's more like it, right? I don't need to give you an answer. You just tell me. And this is before any metrics. So the bottom one is kind of where we want to go, but we try to do that with lowering your blood pressure, your cholesterol, those things that are kind of medical, but I'm not sure that's the right track. Medical doctors are designed to diagnose disease, and then to treat means using a prescription. If you really want the green, you've got to walk, you've got to eat right, you've got to go to sleep on time. Are the doctors the best specimens out there? With me as an exception, I hope. I mean, really, come on. I don't want to be insulting, but most of your doctors, when you sit around the table and they're spouting something, they're not eating nuts, maybe. They don't look like they're in great shape. So anyway, I don't want to be against doctors necessarily. But health-related people might actually serve you so much better, because mere absence of disease doesn't make you healthy. What does healthy mean? Feeling young. Somebody that says, I wake up in the morning and my mind is fresh, I have energy, I have motivation, the energy is constant, not up and down, and I have no stiffness, and when I go to bed, my latency, that's my Oura ring latency, is like when you go to sleep, it takes you 5 minutes, or does it take you 25 minutes, or 1 hour? All these things matter. All these things matter. So what we're trying to say is that if we can measure how fast you're aging, and there is knowledge about how to reverse it, studies, real studies, and it's all common sense, so you can actually feel this stuff, then you can actually have more health span. Everyone has to die, but when we die, we shouldn't have to be a prolonged, long. Did you know that 80% of healthcare dollars are spent in the last 2 years of people's lives? So sometimes medical facts are good, and sometimes wellness-related stuff is good. I like to combine the whole thing together. They're not separate entities. It's a case of, starting off really strong, and over the years, there's a physiological decline. The question is, are you prematurely aging? That's what we're talking about. We're not talking about aging for the sake of aging. Everyone has to age. Every time a cell divides, you're aging. But for every cell division, the old cells are lingering around. If you have too many lingering around, that's aging. And there are mechanisms that I'm going to tell you, the 3 mechanisms, to bring those senescent cells down. Senescents are old cells which you think should just disappear. There are mechanisms for that. It's called apoptosis. But the more of these old cells, they don't just sit around, do nothing. They actually crowd out the good cells, and then they start creating their own inflammation and cause havoc around your body. So the study that showed that in real humans, you can actually slow down the aging process was a trial by TRIM. It was really focused on the thymus. So what you see there is the thymus gland. Their assumption was that if we can stimulate the thymus gland, which is where your immune cells are, maybe we can, use that. And from that, they were able to show that in 1 year period, they reversed the biological age by 2.5 years. So in other words, 1.5 year difference. So that's a real study. And so with only a few people, so they want to now repeat that study. And this is another variation of the epigenetic age, right? So let me just spend just a minute talking about epigenetic age. Just look at the timer here. So I only have 7 more minutes to talk, so you're lucky. I want questions and answers. So what is epigenetic age? Epigenetic age says that, on your DNA, there's lots of information. Those information come and go depending on the switches that are turned on or off. We call that methylation. So certain methylation, and I'll explain that if people want to know, will determine which switches are on and which switches are off. So guess what? If you have good genes, do you want those signals on or off? You want them on. If you have bad genes, does it mean you're going to have disease? What do you want that switch to tell you? You want that switch off. And now we can measure those things. So not only can we look at the entire epigenetic age, because of all the 950,000 locations on your DNA, 130 are more specific for your biological age. And the rest give information of diabetes or obesity or arthritis, and we're getting more and more of those. So yes, we have the location, but we need more data to jump in to be able to say, hey, this is what it looks like. These people that have this location, this switch that's on, tend to get dementia. So that's what you want to know. And so the grim age is saying that when you are like 50 years young or old, the green line would be somebody that's younger than their biological age. They actually have less disease. That's what they proved. And the person who's actually 50, but their biological age is in blue, 60, they actually have more disease. So it's not just a cosmetic thing. It's not just a number. It actually translates to, and GRIM stands for the Greek Grima, apparently. Yeah, so I want to talk about epigenetic age. This is the box, if people don't know what it is. Inside that box is something, oh, look, it's me, Jack in the Box, I came out of the box. No, inside that box is that tiny little thing. How can something so small be so powerful? And I'm not talking about the blood sample, I'm talking about that guy here. Something so small can be so powerful. Just kidding, you didn't get it, that's all right. Good, let's move on to the next, let's look at the next slide. The next slide is really why you're here. Because you can sit in a hyperbaric oxygen chamber 5 days a week, total of 60 sessions, and you can reverse your telomere age by 30%. The same number of sessions can also reduce those senescent cells, those old cells, by 30% almost. But who's going to sit hyperbaric for 60 times, and how often do you have to repeat that? But my program, not a plug for me, but I've been able to, I'm going to show you data that I have that's pretty spectacular, and you don't have to sit in the hyperbaric chamber 60 times. So hyperbaric is a very important one because I can give you all the mechanisms of how it works and why people benefit. Whereas the other things that I want to talk about is, if you don't know the things that are making you older, so if you smoke, are you going to get older? Yes. Am I speaking loud? Yes. You don't have to answer that. Am I angry?
No.
Smart.
Passionate.
Yeah.
I have to check in. Because it's just it's a fine line, as we talked about people with. Okay. I've disrupted my chain of thought here. So the idea is, the epigenetic age is really, really important, and so the idea of why I'm so passionate about it is.
You were talking about the things that make you older, like smoking.
Oh yeah, that's right. So thank you. See, I got to be sharper. So would smoking make you go older? Yes. Would lack of sleep make you older? Yes. I should ask the questions, but I'm going to give you the answers. What if you eat a lot of refined carbs? Will it make you older? Yes. You know how? It's called glycation. So we know about hemoglobin A1C for diabetics. What if you're not a diabetic? You can still get glycation. Glycation are things where your glucose molecule sits on the red blood cells. The more you have, we call that glycation. But there's something that's related to sugar. It's called AGE, advanced glycated endpoints. The more you have, the older you are. So yes, there is a link between refined sugars and aging. That's one of the 3 things I want to tell you about. And so what happens when you, I'm going to go a little faster. What happens when you put in certain nutrients? We call those nutrient sensing pathways. There's a time to grow and there's a time not to grow. When you're an adolescent, you want to grow. When you're older and you have risks of cancer, do you want to grow? Maybe not. Maybe not, right? So when you have glucose, you turn on certain pathways called IGF-1. When you have protein, you turn on mTOR. But we know that when you have cancer, the mTOR is overactivated. So having too much protein at a certain point will make you grow, but it'll also make you older, right? So from the infant to the child, you want to grow. You look at it as a good thing. I'm not dieting it. In your 20s and 30s, you want to grow. It's a good thing. And between 50 and 65, you want to be a little careful. Careful is the word, because we don't know what happens, but we do know something. If you go beyond 65, the risk of death actually goes down. But if you have pro-growth after 65, you may actually turn on cancer. So it's not about numbers, and all that looks good is not always good. You have to know checks and balances. That's why I put down here priming, resetting, reprogram, regenerate, repair. Because we all want the repair. Repair is the growth. But if you don't fix the things that come before, the growth at the wrong time, particularly as you get a little older, I'll just say over 50. But over 65, we then definitely see outcomes in some people. But 50 is where people start to be diagnosed with type 2 diabetes, age-related disease. People start to get diagnosed with osteoporosis, age-related osteoporosis. People get diagnosed as you get maybe a little bit older with memory. So aging is a real thing. It's called age-related disease. And most of the things in primary care are age-related diseases. So therefore, if you can slow down aging, doesn't it make sense that you're going to prevent disease? Well, what makes sense couldn't have been said 2 years ago. But now we can say it because we have these studies that show how we measure people's ages, and the people that are biologically younger had less morbidity. Morbidity is a terminology to say you don't have arthritis and heart disease and dementia. And if you're biologically older, the study actually showed you'll have more of these age-related diseases. Any questions so far?
Yeah, so this is just mind-blowing on a lot of levels, but I guess my question to you, Dr. Habib, is can you speak specifically about how this is, the data behind this, and like how this has been tracked, and what are some lifestyles that have led to, you know, you aging past
Perfect.
your
So
biological age?
that's a great question, and so I actually, I'm not plugging me. I want to actually tell you where this came from. But before I do, let me show you some remarkable results. To get your attention, then we'll go back to this, because that's the right question. You know, it's not just about a fancy number, it's how did you get to that number? If you don't know how you got to that number, you can either pat yourself in the back, I'm doing well, or if the number's not so good, how did you get to that number? If you can't answer how, then you will go down the wrong track. There's no good having a quick fix, a magic pill or hyperbaric oxygen chamber. Sorry, I'm still over, no, just kidding. I want to talk about hyperbaric because this specifically, the studies that they showed with 60 treatments, I've been able to reproduce that in one individual because he did the 60 treatment, and somebody else who did not do the 60 treatments got almost the same results, but with a different metric. So telomeres, everybody tells me, what's telomeres? Telomeres, is telomere, okay. Anybody want to know what that is? The end of the DNA, there's little caps like shoelaces. Your shoelaces are this winding of all the DNA. Once it stays wound up when you're young, is because the telomeres at the end are the things that repair the cell division. But every time a cell divides, that cap, the length of the telomere gets a little bit shorter. So when you're young, your telomere is long, and when you're older, it's shorter. And that was a very, very good number, and we used it for almost a decade. And the two things I want you to be aware of, because they're important, they said 10 years ago, and they researched even longer, that if you have a clean liver and you have high antioxidant function, you can preserve your telomere. They said that a long time ago. And yet, why don't people understand that? Doctors don't understand that. Clean liver, so long as you don't have elevated liver enzymes, you're fine. Is that the case? Remember, the mere absence of disease doesn't make you healthy. We're talking about health. So this epigenetic age is about healthy aging. That's what it's about. So before and after, I boxed the biological age and the true age. Can people see that? So before, I'll just repeat, the chronological age of this individual a year ago was 46, and his biological age was 3 years advanced at 49. Got that? A year later, after having had 60 treatments, his chronological age is 47, 1 year older. His biological age has actually gone down to 45. So the change is 49 to 45 in 1 year. Okay? Now that's me trying to reproduce the studies that are out there. So I'm a clinician. I'm not a lab rat. I don't just rely on data from one person. My job is to get as much information from the conventional medical profession, which we call evidence-based medicine. That's old because it takes many decades to get the evidence, right? Whereas when we talk about epigenetic age, there's not much evidence. It's just coming 6 months, 1 year. So I get as much information from people that talk about how does longevity happen, which enzymes are activated, what causes what's the real root of the disease? Is it inflammation? Is it oxidation? Is it toxicity? I can tell you all these. That's what I want to do in the question and answers. So this person went from a percentile that was more like in the lower 10 to 25 percentile, maybe 25 percentile. He's gone now into the 50th percentile. He's in the healthier range. That's somebody that did the hyperbaric for 60 times. And so, any questions before I move on? Good? Okay.
Dr. Habib, maybe
Yeah.
just, does everyone here know what the hyperbaric chamber is?
Okay, so
maybe
thank you.
address that, Dr.
Perfect. Good man. So the two types of hyperbaric chambers, there's a soft and a hard. So what is hyperbaric? The hyperbaric means that in a space, we build up the pressure using like airflow. So if you have a hard chamber, you can put more pressure in. With a soft chamber, you go to a certain PSI pressure. And what they found with hyperbaric chambers is that it was originally for divers, but when you have pressure, the oxygen in the room goes deeper into your body. In other words, it goes into the cellular space, we call it interstitial space. So you can have more oxygen. Now, if you put a little bit of pure oxygen, under pressure, you can get 10 times more oxygen saturation in your tissues. So if you're an athlete, you'll have better recovery, maybe better performance. A lot of athletes use it. So the hyperbaric works, so this is a good opportunity to talk about hyperbaric, is that it not only works by giving you the oxygen, so under 4 psi, that's a soft chamber. The hard chamber is a much bigger psi, 14. But it can, that translates to deeper penetration. So all the studies are done on hard chambers. Not to say the soft chambers don't work, they actually do, but as far as the studies, they're all done on hard chambers. For dementia, for psychiatric problems, for stroke, for aging, it's done on the hard chambers. And so oxygen under pressure increases the oxygen saturation in your body. That's obvious, right? You can fight infection better. 2 things that you need to recover and fight infections and just be able to live well. Blood flow and oxygen, okay? So all the things we're doing, exercise, eating right, it's all about blood flow and oxygen. And so the point I'm trying to make here is that, but the way the hyperbaric actually not only can reverse the biological age, I said the telomere was reversed by 30%. In other words, the length got bigger. The senescent cells, those old cells, they reduce in number by 30%. It's because when you raise the oxygen in the hyperbaric chamber, and it's now 10 times the saturation, we call it hyperoxemia. That's excess oxygen. You can be toxic, but the studies were up to 90 minutes, that's all, with a few breaks. Now, when you go back to normal, like normal room air, you know it's normal, but your body thinks it's gone from normal to hypoxia. Hypoxia, the body thinks, I don't have enough oxygen, because it got used to the high level. Everybody follow me? Yeah. Mm-hmm. So if the body says, I'm hypoxic, it has a mechanism to say, I know what to do. I have to activate my survival mechanisms. That's how you get the results. So you get results in all the different stem cells in your body. They measure the CD20 counts. So we call this pluripotent stem cells. In your bone marrow, you have multipotent stem cells. The umbilical cord, everyone knows, has pluripotent stem cells. This hyperbaric has been shown to increase the pluripotent stem cells. That means your red blood cells, white blood cells, platelets, immune cells. Pluro means everything that you can think of. And they measure that through CD20 count. Not only does it do that, it actually activates something called vascular endothelial growth factor. So you have new blood vessels. New blood vessels means new blood flow, more blood flow to everywhere in the body. So when we put people in the hyperbaric, we measure the brain scan and the blood flow before, and we get almost a 30% increase after a certain protocol. Okay? And so the idea is that this is not cosmetic. This actually, I'm as a clinician can see how it's translating between the number and the reality. The other things that the hyperbaric does is it activates the antioxidant function. So people with high antioxidants, like that's why I brought this here, this can be good as an antioxidant, but also as a vasodilator. I'll go over the mechanism. Vasodilator means opening things up, because more blood flow is what you're looking for. So if you have more blood flow, then you can get more oxygen into the tissues. So that's how diabetics with ulcers that don't heal after you put them in a hyperbaric chamber. Infections in the bone called osteomyelitis are very, very difficult once they get seeded inside, or like joints. Once they're seeded in deep, it's very hard to get rid of it. But with the treatment and hyperbaric, they are able to overcome it. And so, but we did all those things for so many years, but we never knew what was right underneath our nose, which is that it can actually activate those survival mechanisms, and that's what people are researching. They're researching that through, so I told you, what are the things that make you age fast? One is having refined carbohydrates. There are other things like sleep, that I can list many, but I would say that the next most important thing that ages you fast, particularly after the age of 50, is eating too much protein. Now, when you get to much older, like over 65, maybe 70, and people talk about sarcopenia, where you're losing a little muscle, that's different. That's different, right? Because you're trying to build up to something normal. We're talking about people who just think that more is better. It may not be better. And so what's the antidote to those two things? And the third thing I'm going to say. So the antidote is get rid of refined stuff. Now, this is good, but for people who are really educated, too much of this is refined too, by the way. That's called fructose, which is not that far different from glucose, because glucose is a combination of fructose and something else. So having a little bit is okay, because these are full of polyphenols. So the polyphenols are the things that help you open up your arteries. They work by actually feeding the gut microbes, and then the microbes release what we call short-chain fatty acids. And not only do they open up the arteries, they have actually been shown to recover the mitochondria. We call it autophagy. So the old stuff, the senescent stuff, well, even the mitochondria, they get old, they sit around, they lose their shape. Well, having your gut really be involved, and guess what? When you're fasting, you actually promote the microbes to do more of the same. Because again, all these survival instincts kick in when you restrict calories, which you've known forever and ever and ever. So now we have what we call time feeding or intermittent fasting to reproduce, and they do work, by the way. Again, if you know the precise nature of it, and not the casual. There is some science behind it, you have to follow those. So number one, don't have the refined carbs. And then, I don't eat any carbs at all. So I don't eat pasta, I don't eat bread, I don't eat rice, because I have bad genes, and I've learned, I track my numbers, so I just do better. And the next most powerful thing, I think I already mentioned, fasting. So I do like one meal a day. Now, I didn't always do that, and just recently I did my 3-day fast, and it wasn't as hard as I thought. It's really a mental block. And again, I don't think you have to do all that, but I'm saying that that's how I learn, right? That's how I learn, by the studies and doing it myself, looking at my patients. So what we want to do is recreate that, and one of the most powerful ways is, I could talk about that. Oh, slide went away. Okay, we'll see if we can get the slide back up. So one of the powerful ways is hyperbaric. But if you don't want to be in there for 60 sessions, can we reproduce it? And I had the last slide, was coming, and the last slide would show you somebody who's only in there once a week, but who's part of a strategy. And part of a strategy where we guide people with what to eat. It wasn't calories in, calories out. It wasn't a diet. It was more like, this are the food groups that's good for you, eat whatever you want. These are the food groups that are bad for you, try to avoid that. And we use blood tests for that, to be a little bit more precise. And then what we do is we put them on certain nutrients based on measurements. So if you're low on something, omega-3, vitamin D, minerals, amino acids, we can just replace it, because all your body's asking for is just nutrients and the right environment, the blood flow, the oxygen. It'll take care of everything else. And so you combine the very simple lifestyle of diet, and you give them the right supplements, and then there are some special supplements which I'll talk about, and then you get them to move a little bit. You don't have to be a marathon runner. In fact, if you're a marathon runner, you have twice the risk of a heart attack as the regular population. So excessive exercise is also bad for you. And so, the point here is that that you can recreate the same benefits of hyperbaric, but using it less frequently. I still believe it's a really, really powerful tool to rejuvenate and repair. That if you change the diet, take the right supplements, and I also engage in ways to detox the liver. Remember the word detox? I won't go into it now. I use special therapeutic intravenous vitamins. As a doctor, I can't say that I make diagnosis and treat people with that, but I get results, if you know what I mean. And the results are this. Can we go to the last slide? Oh, I think it's me.
Press up, press up.
Okay, this is the one, right? So this is somebody, this is one of my regular, oh, good, we got rid of one of the name, that's good, yeah. So this is somebody who's 59 years old, but his biological is 51. That's my patient. That's someone that's been with me for 7 years. So I wasn't measuring telomere, I'm sorry, we were measuring telomere. I wasn't measuring epigenetic age 7 years, it wasn't around. So what this is telling me is that whatever protocol I've had him on is actually working. Any questions on that? So epigenetic age is the most accurate way of looking at your biological age and not your chronological age. In animals, you know within 6 months, like dogs, within 6 months of when they're going to die. Now, what we're trying to say is we're trying to get closer and closer to be able to predict things. And is this the only thing? No. That's why, anybody will have any more questions before I go back to something?
What is it, what are all the factors it takes into consideration?
Yep, that's what I'm going to go back. So, can you repeat the question? Yeah, so the question was, what are the factors that cause aging or reverse aging?
That is measured by that score.
Yeah, how does that score come? Okay, I'll go back. So in your DNA, you have all the information wrapped around the DNA and the caps of the telomeres, so we got that. So those locations, we call them loci. So you have a location for maybe, I have a location for diabetes for sure, and obesity. So I want to know if those locations are on and off. Those locations turn on and off through methylation. So what they're measuring is the methylation pattern. And when you see a methylation pattern of the 130 locations that we know are synonymous with aging, they have an algorithm that they can tell you your biological age. And it's called a Harvath plot. The guy from, I think he's from Harvard as well. Sinclair is definitely from Harvard. But you know, these are really talented people that they've been able to, and he's the one that came up with the grim age, the epigenetic age. Any more questions on that? It's all about switches on and off in the DNA. And it's postulated that that's the first step before you get diabetes and heart disease. In other words, it's not the diabetes and heart disease that is turning on those locations. Yes, you're getting older, but those locations may be on, and over time, cumulatively, then you see the diabetes, which then comes back to hurt your aging process, right? And so the aging process is, you need data. You need the epigenetic age, but you need to know your cardiac age. You need to know your immune age, your brain age, your musculoskeletal, your blood vessel age. That's why I don't rely on a number. I was telling you that we don't treat numbers. What are we treating? We ask, why do you want to slow down the aging? Because you want to be youthful. So you have to make sure that all those things that, like making your sugar higher or the high blood pressure, these are actually aging you, but not exactly in a linear manner. That's the X factor. So having that epigenetic age is like the big umbrella. If that is kind of not at its peak, then you've got more possibilities of the DNA being expressed in a bad way.
So, Dr. Habib, can I just, one question here. So, obviously, when you get the data and you're like, okay, gosh, now we're treating it instead of preventing it. I mean, is this strategy working from a preventative standpoint? Like, hey, I mean.
Well, that's what I can tell. That's I'm the clinician. So, because I've had my patients for 10 years, 12 years, 15 years, this strategy, where I didn't even have the measurements for epigenetic age, when I had telomeres 10 years ago, I used to use it. Yes, it does work. And it works because once you collect the data, I make the biological aging process, and I use the multi-system approach. That means that if I see those factors that cause aging, which is inflammation, oxidation, it's a little complex, I can explain that if you want, but toxicity, fatty liver, it's not toxic, but it's a fatty liver, but you can have toxins in your liver too. So I remember telomeres, the person that invented that, discovered that, they said two things. Liver detox and antioxidants will give you healthy telomeres. It didn't change. It's an evolution in knowledge that if you can detox the liver, boost antioxidant function, you turn off bad signals like inflammation. That's where the priming and resetting comes in. Priming means just replenish the nutrients that are deficient. Priming means stop eating that garbage because your blood test shows that this is causing you stiffness, it's causing you eczema, it's causing you headache. Stop that. That's resetting. Reprogram is to now activate the longevity gene. So when you're fasting, you activate something called sirtuin. It's an enzyme. We all have it. If you want to eat a lot of carbs, it's going to go to sleep. If you just starve yourself a little bit or get hungry, it starts to get activated. So that's the reprogramming. Then we regenerate it. How do we regenerate it? Well, multiple ways. One is hyperbaric oxygen chambers. The other one is, we call them peptides. There's signaling molecules. So growth hormone is a peptide. Insulin is a peptide. These are all peptides. Your body has them. So they don't work so well when you don't sleep. They don't work so well when your diet is off. So it's us stopping them working. So I try to make the changes, but not everybody's perfect, including me. So we try to activate that. That's the reprogramming, and then they can regenerate. The repair is the end point. Some people say to me, well, I see the blood flow going up. How come my brain memory's not back? I said, first you have to nourish the brain. You've got the environment. Now you've got to give the brain time to use that oxygen to repair itself. So you can't go from down here to up here. There's a stepwise down, there's a stepwise up. And that's what I mean by priming, reset, reprogram, regenerate. So, and I've been able to prove that because I have my own patients with data like this, where they're biologically much younger, but so does he have diabetes? No. Did he have problems? Yep. He had like, I think, weird endocrine cancers like carcinoid, which is in the intestine somewhere. Then he had the low testosterone, and he had a lot of problems. He overcame those. And in order to overcome those, you've got to change your diet. You've got to change your lifestyle. So no one's going to tell you that there's a magic treatment for reversing the aging process. That's all you got to do. There's no such thing as a magic treatment. However, there are things you can do to help yourself, but synergistically, it's so much easier. And if you know what I mean by that, what I would say is this, as some different analogy, but you know, a lot of people want to see the results, and the way I describe it is that you're working so hard at changing your diet, lowering your blood pressure. That's like pushing a stone up the hill, and you've done a really, really good job, but you kind of feel like, I want to stop. What's going to happen?
Right back.
Not right back, it's going to come back. It's just got to take a little bit more work to get over the hump. Then what happens? It's a lot easier. So we've got to go through the steps. I want to show it again, I think. We have to go through the steps of assessing and then getting a program to get through the prime, resetting, reprogram, regenerate, repair. Repair comes when you get to the top of the hill.
And Dr. Habib, I know everyone's different, but are these plans customized based on the testing?
Yeah.
Can you just share with us
Yep.
some of the testing that how you figure out the programs?
Perfect. The question was, are these programs customized, personalized? So your lab, you can have the same lab data as you, but there are variations because your family history, because I do genetics too. So the idea is, for me, I like the epigenetic age because it gives me a big bird's eye view. It's like my own epigenetic age. So I'll use my example if you don't mind. So I am still 52, almost 53, and my biological age is 42. So you're going to say, well, you must have good genes. All right, well, so I'm going to use my example. So you're going to say, oh, you must be genetic. No. Both my parents have diabetes. Both of them have hypertension. My father died of a heart attack at 65. My mother had a stroke at 75. You're going to tell me my genes are okay? Actually, I have genetics to tell me it's not okay. I have MTHFR, I have ApoE, I have 1q25, which means my intestinal lining is not that great. I have to be proactive. So I couldn't get away with that diet based on a blood test. So if I have gluten, I get joint pains. So everybody has their own testing to know what food is bad for you. Then my vitamin levels were always low, and I couldn't figure out why. I ate so many fruits and vegetables. It's because they weren't getting absorbed. Or when I put them in, my body was expending at a faster rate because I was working so hard. I didn't go to sleep that much because I didn't need it. I woke up pretty feeling good, and I had children. But it took a toll in my late 30s. And then early 40s, I started getting leaky gut and inflammation. I said, what the hell's going on? So we check for these things, right? So everything that I'm telling you, I actually had it. So I can understand it at a deeper level. It's not theoretical. So it's customized assessments of which food can be harmful. It's customized evaluation of which nutrients, amino acids, B vitamin, antioxidants, omega-3, minerals. These are measurable and need to be measured. It's probably more important in some ways because if you can just avoid the bad stuff and have the good stuff, you're way on your way. It's only when the genetics is against you, you've got to work a little harder. That hill might be steeper than you think. You just don't know. So genetics helps me predict and help me understand that actually I can't be like everybody else. But somebody else may not have genetics but still have problems. Their job is much easier. They don't realize it. 90% of the diseases are not because of the gene. Only 10% is because of genetics. In fact, we don't even have a gene for heart attack. We don't have a gene for diabetes. We don't have a gene for arthritis. We don't have a gene. If we have genes, it's like the minority. So what does that mean? Most people are not predisposed. I know some people have family history of it, but even they brought it on by refined carbs, not sleeping properly, having a dysfunctional gut, deficiencies. And so some of the other testing is the advanced cardiac because that is the number one killer. So the inflammation is actually not cholesterol. It's inflammation. Did I say inflammation? The information like inflammation, like oxidation, like enzymes. These and the molecular size of the LDL. Those are the things that actually cause cardiac demise. they're actually the things that cause aging too. That's why it's important to get the heart age, the brain age, the immune age. And there are more testing, but we don't necessarily test everybody for everything, like heavy metal toxicity. So if I see something like oxidation, so I can bring on oxidation. What is oxidation? So I eat this food and I want to burn the glucose and fuel, I need oxidation, right? But if you have too much oxidation, like you smoke, that's too much oxidation. And if you have a high-fat diet, there's more oxidation. If you eat too much, there's more oxidation. If you don't exercise, there's oxidation. So too much is a problem. So you have antioxidants, right? So you have antioxidants to counter that. But the problem is that that you don't realize that some of the foods and additives and chemicals, they are pro-oxidants. So heavy metals, of all the people that I test for heavy metals, at least 50% have heavy metals. Lead, arsenic, cadmium. Gadolinium is like the dye that you have in the radiological testing. It's actually in your body and it stays in there for a long, long time. Those cause oxidation. Oxidation leads to blockages. Oxidation leads to DNA damage. Oxidation amongst inflammation and insulin resistance and toxicity are the drivers of aging. Sounds complicated, but really it's all in the environment. And your environment is not only sleep and the air you breathe, but more importantly what you put in, because you can put in a lot. Okay. So hopefully this could be the beginning of that series that goes into the nitty-gritty of why we should. So let's sort of say we're trying to figure out how fast you're aging because we want healthy aging. Healthy aging is not a theoretical or a cosmetic thing. It's actually evidence-based medicine now, and it's going to increase rapidly and make cholesterol testing obsolete. Maybe it won't, because there's a lot of people that make a lot of money out of it. I just want to bring you down to earth. But definitely a new way of practicing medicine that says if you stay biologically younger using real medical parameters and the latest technology and discoveries, you can actually slow down the aging process. I myself am an example. Many of my patients are examples. So I actually practice what I preach. So there's nobody that's going to doubt what I say because I have evidence. I'll stop at that point and just see if you have questions. You already have good questions.
I have more. Does anybody else have any other questions? Because I'm going to keep firing them. Okay, all right. Can you talk about detoxifying
Yes.
and why that's so critical and what we should be doing?
Yeah.
It just seems like we're in a day and age now where immune function is on people's minds. We're just still in the midst of a pandemic. And how important is it that we're just taking in all these toxins everywhere that we're detoxifying?
Well,
how do we do it?
Repeat the question. Yeah, so the question was about detoxification. You know, this environment that we have. I was just going to go into what we mean by toxicity, and first of all, let's talk about some of the things that are reflective of toxins, should we say? So, if you have alcohol, is that a toxin? It's a toxin. Yeah, and so we know because there's a measurement in the liver test called gamma GT. It's very high. Not in everybody. It all depends on your liver is different to my liver is different to your liver. So some people get away with it. So there are ways to look at liver toxicity. There are ways to look at toxicity in the fat. Very, very important. I'm going to repeat that again. Liver toxicity is really, really important because the liver is so amazing. And if you don't respect it, your detoxification, your metabolism, your methylation, it's all in the liver. That detox is not a fancy word. There is a reason for why the liver is so powerful. And one of those reasons is that the liver produces glutathione, the most powerful antioxidant. You've heard that in passing. It really is powerful. But where I use it therapeutically through the vein, it's really, it doesn't treat, but it gets results. Do you see why I'm saying that word treat? Okay, just for people who want to use words. So
And that is just to be clear, that is IV treatment.
that's intravenous, right? You're right. Because antioxidants can become oxidized. So if I have my, like iron and rust, that's oxidation. If you leave a box, a container of vitamin C, it's powdered white. If you leave it out long enough, it becomes yellow. That's oxidation. Right? When you have fat, like you have the vegetable oils and you think it's okay, it's clear. I used to think it was okay. It's oxidized. Just because it looks okay, it doesn't mean anything. Because the processing oxidizes it. You have olive oil in the raw form. That's good. High in polyunsaturated fatty acids. Actually now it's showing that it may activate longevity genes. But if you cook it in high heat, you've oxidized it. And don't let me put you off olive oil, but slower heat, gentle heat is better, but the benefits of olive oil are from raw olive oil. So I use like coconut oil sometimes, some ghee, clarified butter sometimes. So again, going back, I don't want to lose track of what he said. That was a very good question. Toxicity. So we know evidence-based that if you're obese, you have more inflammatory cytokines. Where does that come from? Between the fat, particularly on the inside, we call it visceral fat, the ones around the organs like the liver, fatty liver, around the heart, the blood vessels, inside is very inflammatory. But the liver and the liver talk to each other. So when we say inflammation, we have a marker called HSCRP. It's released by the liver, but the liver doesn't release it without information from the gut microbes. So if you have a high inflammatory diet, a refined diet, if you have a certain diet, the microbes communicate to the liver and then the liver releases it. So is HSCRP causing you inflammation? No, it's just a marker. These are just numbers. They don't hurt you, they don't harm you. They're just information. But your doctor doesn't think like that. He thinks your LDL is killing you. He thinks your sugar is killing you. They're just markers, they're information. You have to ask yourself, where are these markers coming from and why? The root cause is inflammation, oxidation, insulin resistance is number one. Toxicity at the liver level, at the adipose level. Those are the things that are actually killing people. They're actually aging people, and rapidly aging people get premature disease, and without medication, they will die even faster. And medication does not cure anything. It controls it. So if you have cholesterol pills and you stop it, does the cholesterol go away? It's still there. If you have diabetic pills and you stop the diabetic pill, the sugar is still there. If you have blood pressure pills, you stop it, the blood pressure is still there, unless you understand what causes it. When I lower inflammation, the blood pressure goes down. When I lower inflammation, the blood sugar goes down. When I lower inflammation, the stiffness goes down. That's evidence-based medicine. But I can't say I do that with a vitamin. I can't say I do that with IV vitamin. I can't say that I don't do that with diet and lifestyle. But I get results using those things, if you know what I mean.
So can diet be a form of detoxifying?
Absolutely. So one of the things is that you're putting, so diet, eating actually is yeah. The question was, can a diet be a form of detox? Yeah, it can be both. So when you eat, there's actually a lot of taxation on the system. But it's necessary because you got to eat, right? But too much can be, I'm one of those. Too many vegetables is a problem too, by the way. So too much is a problem. But what if you have constipation? Where does that go? It stays around. So best way to detoxify is go to the bathroom, have a poop. And those people have a lot of problems, believe me. Anyway, sweating is a great way to detoxify. Saunas, Finland study. If you do sauna more than 4 times a week, you have almost 50 to 60% reduction in heart attacks in the Finnish people compared to people who don't, like once a week. So I do saunas like 3 times a week. I do hyperbaric 3 times a week. Not because I'm crazy. I still exercise. I still change my diet. I don't want to live forever. I just want to live well. And I think I'm in the right direction. So my lab is confirming I'm in the right direction. If I can't help myself, how can I possibly help other people? And if your doctor can't help himself, you need to find a new doctor. I'm not plugging myself, but I have my business card right there. No, I'm trying to actually save the world by education. Because all the things I said, you could have done by yourself. What are the 3 things? Well, 2 things. You can do more. Don't have refined carbs, so reduce it. Start to go to complex route. You know, white potato, how about a sweet potato? How about a root vegetable? How about beans? How about lentils? I know you're going to say it's boring. Then you need to come to my cooking demo, and I'll teach you how it's good. Yep. So that's one way, right? And we said that the other one was fasting. It's free. You don't have to pay anybody. Yeah, please.
I know Eric is getting tired of asking questions, so.
Thank you, Dan.
Yeah, he's wondering.
Maybe he's stand-up. Well, are you going to be doing this more, or is it going to be?
I'm one of those. I'll do whatever you want.
So I'm 85 years old.
Okay.
He's like, okay.
His biological age.
Biological.
Yeah,
Adam,
there you go. His biological.
So
you look great. The skin is wonderful.
All right.
But seriously, doctor, I'm a believer of anti-aging. Without you knowing, I was a major part of this industry for a long time.
That's
vision.
right, that's right.
So I get a chance to speak with him, and everything that he's saying is
Yeah.
tremendous. And for someone like you who is a medical professional, you know, educating the public about anti-aging, and the thing that is yours, I mean, the crowd here, they should be packed. You should be promoted properly. And I'm gonna work with Nicole, I'm gonna work with Taro.
Appreciate it, yeah.
There'll be a lot of people here, because this is something that you hear in the public.
Right, and, yeah, sorry.
And then, I mean, look, seriously, I've been taking everything that I could take. But obviously the hyperbaric, you know.
It's something to
that I'm
definitely
very,
incorporate.
You know, not very familiar with, but, everything they're saying I'm very familiar. Antioxidation. I actually do demo.
Yeah.
Because people don't get it,
Yeah.
okay? And all they have to do is, you know, unpeel all those bananas and leave it there for a few hours.
Right.
It becomes brown.
Yeah,
That's
that's
exactly what
oxidation.
happened to us.
Yeah.
You know, everything, the sunlight,
yeah.
everything that we eat, you know, the chemicals,
Yeah.
a lot of people don't know that.
It's funny, you can
I mean,
actually see.
Jeff
Yeah.
eats anti-aging.
Yeah.
yes.
No, it's like, well, you know, when you have food,
Need it.
yeah, you know, when you have food and it becomes brown, that's glycation.
Exactly.
Yeah, so when you're getting more glycated, you're getting browner. In fact, the fat turns more and more brown. You know, brown and more rancid, I should
As a matter
say.
of fact, I'm gonna be lending you a material, right, that was shared by Dr. Goldman and Dr. Claps, wherein they showed two men. One was 40 years old,
Yeah.
who looked like 85.
Right.
One was 80, who looked like 40.
That's right.
So it's basically the biological aspect.
Yeah, so I think, yeah,
That's-
that's so what you said was, you know, somebody who was older who's older but looked really young, and somebody young looked really old. And that's what Eric was saying is that, look, it's not about the number. The number is nothing. It's really how you feel
Exactly.
and function. So, you know, if you get older, you want to get older feeling good, functioning well, being able to run around, play, or whatever, travel, and you should be on no prescription medication. And when it's time to go, you should go restfully, like that red part of the diagram. Just should be a short window. That's what normal is. We've been sold that what we have now is normal. It's not normal. We've been sold that it just happens because of aging. Wrong. We are creating aging. We are creating aging. And I don't think the doctors are versed in nutrition. They're not versed in nutrients. They're not nutrient sensing pathways and medical terminology.
Yeah.
Everything I just said about mTOR and IGF-1, everything about AMPK, these are medical terminology, but they don't read it. Because they just read the abstract at the end of the journal, which was on this drug did this and this drug didn't do that. They didn't, for a minute, study. Now, I'll tell you a good thing about, I'll finish on a positive note. Metformin, this is how metformin works. So we use that for very early diabetics, should we say. You can't usually use a prescription without a diagnosis. So if you don't have diabetes or prediabetes, you shouldn't be able to get it. So metformin helps keep the sugar level down. It doesn't make your insulin go up. It makes the insulin that you have work better. We never knew the mechanism. We believed it worked in the liver somehow, some way. Now we know the mechanism. And that mechanism is not only good at keeping the sugar under check, it actually is anti-aging. So when it comes to metformin, it damages the mitochondrial membrane. What happens when you have damage? Your body responds. The mitochondria have what we call electron transfer chains. That's how you get energy, electricity. Literally, it's mechanical, it's electricity inside these energy things. And so when you have damage, the body makes more channels. That's one way. And then when you have damage, because the metformin creates the damage, you make more mitochondria. That's the mechanism of not only controlling the sugar, because mitochondria give you more energy, burn more fuel, your sugar goes down. But it also may have anti-aging properties.
Right.
That's the mechanism.
And by the way, you know, those two doctors I mentioned, they coined the phrase anti-aging.
Yeah, they did. They're the pioneers.
The dictionary.
That's where I learned my stuff, is from anti-aging, from the pioneers and the researchers. So you have to get all the information from everybody. And so the good news is that there's different ways to put them together, but putting them together is more beneficial than any single modality. And I'll finish on this note, one of the final things. It's not about the number, it's the outcome. Do you feel good? Is your body composition good? Are your joints and muscles moving well? Is your brain functioning good? Is your sexual function good? That's where the rubber meets the road. If you say yes, I don't really care about the number, but it's nice to match the number with how you feel. That's the point.
We have an online question.
Yeah, go for it.
Says, what's the best way to control and lower inflammation?
The best way to lower inflammation, I'll give you quick answers. One is reduce refined carbs. The other one is actually to have good bacterial flora by eating more vegetables. Vegetables have the fibers that the bacteria can feed off, and then they will send the signal to turn off the inflammation signal in the liver. Does that make sense? Just quick answers to inflammation.
And then you were mentioning the three, like the title of the talk is three most powerful ways to slow down aging.
Yep, so-
You mentioned two of them.
Yeah, the third one, because I wanted to give the make a kind of a be provocative. The hyperbaric is a game changer. Is a game changer because before that, if you don't have imagination and believe something is possible, will you ever get there? No. So I always had imagination, by the way. Now I have belief because we've got evidence.
Yeah.
But I already had the evidence actually. I was getting these numbers a long time ago.
Do you have to eat raw vegetables or?
Very good question. The question was, do you have to eat raw vegetables? There's a time and a place for it. If you were about 100 years ago, you could probably be able to digest the raw stuff better, but right now we don't do such a good job. The benefits of raw is that they have the unadulterated enzymes, different enzymes to your longevity enzymes, but still nevertheless very important. So there's some value in it. The problem is that if you have too much of that, you tax the detox system. You can put more taxing on the gut lining so you can get more leaky gut. I've seen it actually happen, right? So you have to be careful with that. And even if you juice that stuff, you have to be a little bit careful. Now, I'm not saying that you can't have some. I have salad. I don't cook my salad, but unfortunately, I do eat a lot of salad, but I like it.
So it is okay to eat cooked vegetables or something?
I'm gonna get, yep, so raw vegetables okay, but be careful about how much. And then the cooked vegetables actually are not bad. When you cook tomatoes, you release certain chemicals that are not in the raw version. When you've cooked it, it's easier to process. We call it assimilation. So then you can break it down and absorb it better. So our bodies have become like that. So you have to be realistic. 100 years ago, like animals, we may have been able to produce our own vitamin C. A sheep, when they're sick, makes 100 times more vitamin C. We can't make our vitamin C. We've got to consume it. So you have to respect who we are now, not what we should have been. That's what some people are like on black and white. There are this or that. The truth is somewhere in the middle, right? So cooked vegetables cooked food is actually good. But if you're slow cooking, hands down is always the more healthy option. The flash frying, the high heat is not good. I mean, I like my seared salmon too, and I'll do that. But you have to understand that the slow cooking has less glycation, not just for glucose molecules. Everything has glucose molecules. Your protein has glucose molecules. Your fat, it's CHO. That's fat. So it all has carbon, so it can all get glycated. So if you heat high temperature, you get more glycation no matter what. But not if you go in a sauna, that's different. Another benefit of saunas is that, again, new data. It produces what we call heat shock proteins. Heat shock proteins repairs the thing that actually processes damaged DNA. So when you get cancer, almost all those people have lost checkpoint inhibitor. It's called P53. When you get heat, you reactivate heat shock proteins, they will reactivate your P53. Fasting will reactivate it. So who says you cannot prevent cancer? I can't even say that. I don't want to say it. I'm just going to tell you what I can say. But I can't tell you that heat will activate P53, and almost everybody that has cancer has lost their P53 gene. It's turned off. It's a signal. Wake it up. It can be woken up.
Dr. Habib, can you speak to, because I am somebody who goes to your office, I will say that. And
I pay him to say that.
Yep, and I enjoy the hyperbaric and the infrared sauna. While we're on the topic of saunas, can you just quickly explain the difference between a traditional sauna and the infrared specifically, because that's what you have in your office?
Well, look, the Finland study was on regular sauna up to 170 degrees, and they got tremendous results. The idea of the infrared sauna is that at a lower temperature, you can get deeper heat. The infrared goes deeper. And just like exercise, when you heat up the muscles, they're deep. And then the heat from there has to come out. They bring the toxins out. Why? Because toxins are stored in the body fat, even on the outside. But the inside ones are more smart. They turn on signals and stuff. Outside ones are not so smart, but they have their own destructive mechanism. And so when I go, so I've been in both, right? I go to the gym and it's a regular sauna. I at the lower temperature in my infrared sauna, I'm already sweating like a pig. I didn't say that. Sweating really profusely.
What temperature do you do your infrared?
My infrared can go up to 150, but I get to 130 and I'm already sweating.
Oh, 130 will get you there.
Yeah.
For how,
Not,
like, So sweating in
1 hour.
3 hours.
Yeah, how long to be in the sauna? 1 hour. Now look, refine your food, the more narrow your microbes. That's a general statement. So if you do the fermented food, that's a great idea. Some raw, diverse types, not the same vegetable, not broccoli every day. Rotate through the different cruciferous vegetables, rotate through all the green leafy vegetables, the salad, variety, you know, and have fun. If you don't have fun, how can you sustain it? I don't give exercise prescriptions to anybody. Activity, routine, and then we build it up slowly. No diet, no calories in, calories out, doesn't work anyway. And they do much better because they can stick with it, and I've got to the root, so then their body starts to work better, then they start to lose the fat, then they feel good. It's like, hey, I like this. I make it easier for them. That's where the numbers come.
What's the cause of children that have cancer, that get cancer?
Well, look, now we're getting into a very targeted area, so the good
But I
news,
mean,
yeah.
they're not old, they haven't
Yeah.
through all those.
Yeah, so children with cancer. So what I'm going to say is that almost everything has some kind of genetic predisposition. When I said 90% is not a gene, as of what we know. So there has to be some propensity potentially. Now, the thing I can tell you is that as the cells are dividing, there's more room for error. So if you have magnetic fields, you're eating a whole bunch of junk, and your microbes are bad, I can't tell you that's the cause of it. I'm going to tell you that those are the things, the variables that contribute. Because they cause oxidation. No one's going to argue with me about oxidation is bad and damage your DNA. Who's going to argue with me? No one, because it's a fact. We can argue that, you know, that heavy metal in the kid's blood caused the cancer. We can argue because I can't tell you cause and effect. Your cholesterol doesn't cause your heart attack. No one's going to argue with me. It does. It's an association. Nobody's obese. Okay. All right. I can pick on Eric.
Yes, you can.
Your obesity caused the cancer. Yeah, he's a good sport. He's got thick skin. Your obesity caused cancer. We can't say that. It's an association. Doctors are very conveniently give causes, and other times they say, well, there's no evidence that that vitamin or that therapy, you know, it's like you can't have both. Most things are association because there's so many moving targets. As we're getting more defined, we're getting close to what might cause, and when we get closer, we get close to what might. We'll never find a cause. We don't need to. You just need to know the big picture. You need to get closer to the real thing: inflammation, oxidation, toxicity, insulin resistance. And I'm not saying run away and ignore high blood pressure, diabetes. I'm just saying that's not the answer. You know why I know that answer? Because those numbers are going up. Heart disease is going up. Diabetes is going up. I think by 2050, 2/3 of the population will be diabetic. And did you know that insulin resistance actually is the driver for heart disease? So, you know, diabetics, heart attack. Well, insulin resistance can happen in non-diabetics too. Sorry to speak about something that we're not talking about.
So depression would be cyclical. In other words, you could control that with a diet, but it's also you can control it with the diet. But I'm trying to think of the underlying cause.
That's good. Let's keep it simple because I'm not a psychiatrist, right? I don't want to go beyond my certification.
No.
Question.
Yes. Yep. So yeah.
Yeah. It sounds like a diet would
Yeah.
control that.
So question was, can diet and lifestyle affect depression, and can it be helpful?
Yeah, or depression makes you sick too.
It does. It's a two-way thing, right? The immune system is not the gut. People say it's 80% gut. I actually will hazard a guess, and my guess is that 50% is the brain and 50% is the gut. I would have said the same thing. 80% of your immune system is gut 2 years ago. Now with all the evidence that I have, 50% is including for myself. 50% is the brain, 50% is the gut. Going back to your question about, you know, can diet and exercise be part of the depression story? Well, where does serotonin come from? Even though 90% of the serotonin is made in the gut, I just said that to get your attention. The enzyme hydroxylase 1 is in the gut. The hydroxylase 2 is in the brain. That's the one that makes serotonin in the brain. But there's crosstalk. So yeah, even though we keep saying the serotonin is made in the gut, but there's crosstalk. So having the healthy gut will go through the blood-brain barrier and will make an impact. So holistic psychiatrists definitely change the diet for sure. And you have to do the same things. Turn off the inflammation. Stop eating the refined stuff. You can't have kids that are eating processed food with coloring additives, preservatives, and say their ADHD needs to be controlled with Ritalin. Get rid of that first. I'm not allowed to tell you that Ritalin is not the right treatment, because apparently it is, because you get reimbursed for that. I don't. But you got to get, so when kids get high and, it's not the sugar, it's those coloring and chemicals produced, because what we know is that like sulfites increase norepinephrine and epinephrine. So if you're susceptible, because you have a COMPT gene, I'm speaking fast, so that's what, it's better whether you know the genes or not. Don't do it, or do less of it. And if you did it, you're older now. So I'll finish on this note. How many times have I finished? I finished on this note.
You're not going to finish. I have another question for you.
Yeah, so I'll finish on this note. I used to want to live so I could eat, because I was overweight actually. But now I want to eat so I can live.
Wow.
It's such a cliche, but somebody made that cliche because it's real. And now that I've measured it in myself, it's easier for me to do a 3-day fast. I just did my first one. I'm just saying that you have to believe here, but the number sure as hell helps, because most of us use data. It's no good saying, believe me, do a little meditation, do a little deep breathing. Yeah, you will, and then you stop. But when you get it drummed into you, and it's drummed into me, I had to drum myself. I don't have a doctor, by the way. Can you believe I don't have a doctor? I don't trust no doctor. Not one with a license, that's for sure.
Does anybody else have any questions for Dr. Habib before we let him go on with his day? I will. One more on there.
You can read it out loud.
I'm a doctorate student in natural medicine. I'm a fanatic of oxygen therapy for disease control. Personally get IVs twice a week. In addition, it's safe. In addition, I eat 1,000 calories of food a day. A day? All other meals are vegetables with occasional fish. And I've been doing this since April the 3rd and had blood tests 3 times, which have all been in range. What are the thoughts about this? Well, when you have a question like that, that's where my medical training comes in. And my medical training has to ask, how old are you? What gender you are? What's the family history? You need some context. But I mean, the gist of everything was good. I just didn't agree with 1,000 calories of fruits. Now, it may be okay for them. Remember I said? So I used to eat so many fruits, but my sugars were so high. My ApoE gene meant that my memory was going down in my late 30s. So we now know the ApoE gene is a moderate to severe risk factor, depending on which combination of the ApoE, right? The 4 is the problem, but if you have 2 4s, then you got severe risk. If you have 1 4, it's moderate. Moderate is no joke, right? But I can tell you my brain functions pretty damn good ever since I understood my genetics and how food and the lifestyle allows my bad genes to come out, or I can suppress it. And I not only have I done it for myself, I do it for my patients. It's real medicine. What may be theoretical for somebody, it's real for me. Everything I said, 100% objective, 100% real data, nothing theoretical. Only theoretical is what the people discovered about the hyperbaric. But I've got my own data, right? I just told you, I got my own data. My data is even stronger in some cases.
Well,
last question.
I just had a question based off that. So how many calories would you say would be ideal?
Yeah, so I don't do calories in, calories out, right? So I just said that phrase because that's how people think. It's not calories. So you could have the same calories from 2 different foods. You can have 1,000 calories from walnuts, and you can have 1,000 calories from fruit. Now, they're both good. I'd rather get it from the walnut, because fats don't activate growth pathways. The fats are nourishing to the brain and the nervous system, and can reduce inflammation. The sugars is fructose, you see. Fructose is no different to any other sugar as far as the insulin. When the body sees fructose or glucose, it doesn't care. It's going to spike the insulin. So don't do too much. If you're going to do it at the end of the day. I mean, end of the meal, sure. But that's for me. I'm not saying it's not, you're okay. I mean, you could be okay. You look okay to me.
That's where the testing comes into play.
For you, it's a different story.
Right. My testing was crazy.
Just stop
Fluid
it.
inflammation
That's
testing.
why I had this here. It's very visual. I'm not going to eat it. I won't get it too late.
We are a business club, so before we get Dr. Habib out of here, I just want to thank the Tower Club and the staff for putting this event on. Thank you to our guests. And I just encourage all of you to think about the economic impact of not taking care and investing in yourself. Dr. Habib and I have spent hours talking about how dementia and Alzheimer's could completely bankrupt our country. And if we're not doing these things and preventing and investing in ourselves, then what are we investing in? There's no greater stock, there's no greater real estate acquisition, there's no greater business than the business of feeling good, because that allows us to achieve success that we don't think we can. So Dr. Habib, thank you for your time.
Thank you.
Thanks for all of his information is available. I would encourage everyone to call him.
Quick questions, and spread the word. Definitely.